For convenience and understanding, the thigh region is classified into three compartments: anterior, medial, and posterior. Here we address the muscles of the anterior compartment of the thigh, and later the medial and posterior compartments will be discussed exclusively. The anterior thigh muscles, which are also called the flexors of the hip and extensors of the knee because of their applied flexion at the hip joint and extension at the knee joint. There are a total of 9 individual muscles in the anterior compartment of thigh: Pectinius, Iliacus, Psoas major, Psoas minor, Sartorius, Vastus lateralis, Vastus medialis, Vastus intermedius, and Rectus femoris. The Rectus femoris, Vastus lateralis, Vastus medialis, and Vastus intermedius are collectively named as a group of 4 muscles called the Quadriceps femoris. Another group of 2 muscles called Iliopsoas includes Iliacus and Psoas major. Actually, the Iliopsoas is considered more as a single muscle having 2 parts: Iliacus, the lateral one; Psoas major, the medial one. Most students are confused regarding whether the Psoas major is part of the Iliopsoas group or the Psoas minor. So don't forget this. That Iliopsoas includes Psoas major with the Iliacus. Regarding the nervous supply of the anterior thigh muscles, remember a point. Only the Psoas major and minor are supplied by the branches from the lumbar plexus. All the remaining muscles are supplied by the femoral nerve. Regarding the main action of all the muscles, remember 2 points. 1. The group of Quadriceps femoris acts mainly to produce extension of the leg at the knee joint. 2. All other muscles contract to produce flexion of the thigh at the hip joint. Now we will discuss the attachments and nerve supply of all muscles individually, and at the end, clinical correlation will be discussed. Iliacus originates from iliac fossa. Psoas major arises from lumbar vertebrae. They join each other and are inserted at lesser trochanter via a single common tendon. Because of their joining, they are called iliopsoas collectively. The iliacus is supplied by the femoral nerve, and as explained earlier, the psoas major is supplied by the lumbar nerve. They contract to produce flexion at the hip joint. Psoas minor arises from sides of T12 and L1 vertebrae and their intervertebral discs, and is inserted at the pectineal line. It is also supplied by a branch from the lumbar plexus, and its main action is flexion of the thigh at the hip joint and stabilizing the joint. The pectinius originates from the superior ramus of the pubis and is inserted at the pectineal line of the femur, just inferior to the lesser trochanter at femur bone. Its main actions are flexion of the thigh and its adduction. It is supplied by the femoral nerve. It may also receive a branch from the obturator nerve. Sartorius muscle is also called the talar muscle. It is the longest muscles of the body. It originates from the anterior superior iliac spine on the femur bone and is inserted on the superior part of tibia at the medial side. Nerve supply is from femoral nerve. Action on thigh includes flexion, adduction, and lateral rotation. It also flexes the leg at the knee joint, which is important to remember because it is the only muscle in the anterior compartment of the thigh to produce flexion of the knee. Quadriceps femoris includes 4 muscles: Rectus femoris, Vastus lateralis, Vastus medialis, Vastus intermedius. Rectus femoris originates from anterior inferior iliac spine. Vastus lateralis originates from greater trochanter and from linea aspera of femur at its lateral lip. Vastus medialis originates from the intertrochanteric line and from the medial lip of linea aspera. Vastus intermedius arises from the anterior and lateral surface of the shaft of the femur. All these muscles conjoin to form a single tendon and insert to the base of patella. They also have independent attachment to the base of patella. All the 4 quadriceps femoris muscles are supplied by the femoral nerve. All these 4 muscles collectively act to extend the leg at the knee joint.